Parents, listen. Has your child been to countless doctor appointments, had multiple rounds of blood work, maybe even MRIs or other expensive tests, yet you still don't have real answers about what's causing their chronic health struggles? You're told that everything looks normal on their labs, but your child's still struggling with the sleep issues, the digestive problems, the behavioral challenges, or developmental delays. Meanwhile, your pediatrician keeps saying they'll grow out of it, or offers another medication to manage the signs. But what if I told you that there's a crucial exam that reveals the real root cause of your child's health challenges? One that most doctors never think to perform. An assessment that's so advanced that can detect the hidden dysfunction that traditional medicine completely misses. Yet, it's completely safe and non-invasive for your children as young as 1 day old. Parents, here's the staggering reality that should concern every single parent. Traditional medicine relies primarily on the signs and looks for obvious pathology, on standard exams like blood work and MRIs and EEGs. Yet these tests often come back normal, even when children are clearly struggling with significant health challenges. What's missing from this approach is an assessment of the most critical system that determines whether your child is healthy or not: the central nervous system. Now, Dr. Bruce Lipton, a renowned cellular biologist, puts it perfectly. The function of the nervous system is to perceive the environment and coordinate the function of all other cells. Now, this means while you've probably invested considerable time, energy, resources trying to improve your child's gut health, their immune system, their motor development through various therapies, most healthcare providers have completely overlooked the one common thread that ties them all together: the nervous system itself. Now, our central nervous system serves as air traffic control for your child's entire body, coordinating every internal function with every movement, thought, emotion, behavior, and cognitive process, making it the most important system to assess. And while traditional medicine chases the signs and movement-based therapies assess muscle tone, pediatric chiropractic is the only healthcare approach that directly evaluates nervous system function through advanced technology. Now, your child's brain doubles in size during the first year of life. It makes the most connections that it'll ever make within the lifespan within the first 2 years. And it'll continue making rapid development, making the nervous system assessment during this critical period far more important than knowing where they sit on a height chart and a weight chart. But here's what the 3 INSiGHT scans reveal that no other exam can detect. First, the neurothermal scan identifies regional effects of subluxation and dysautonomia, affecting your child's digestive system, their immune function, their hormones, and their sleep regulation. Now, this explains conditions like colic, reflux, constipation, ear infections, and allergies that traditional medicine cares for as separate and unrelated issues. Secondly, the neurospinal EMG measures neuromotor system function and is vital for investigating conditions like autism, sensory processing disorder, ADHD, and anxiety. Detecting 3 key patterns that we call raging bull for our hyperactive and anxious kiddos, drunken bull for coordination and focus challenges, and a raging drunken bull, which is a combination of both. The third test is heart rate variability. Now, this assesses your child's adaptability and resilience, revealing whether the nervous system is healthy and balanced or stuck in chronic stress mode. The key marker that determines if they can properly adapt to their daily physical, emotional, environmental challenges. Now, the thing is these scans explain what traditional medicine can't, because the INSiGHT scans detect subluxation and dysautonomia, the real root cause creating 3 major problems in your child's nervous system: their stuck stress and tension, lack of balance and coordination, and overall disorganization and dysfunction. Now, these scans reveal why children don't actually grow out of early problems like colic and tantrums, but they instead grow into more serious conditions like ADHD and anxiety, sensory processing challenges, and chronic illness as they age. The technology itself provides precise measurement and tracking of nervous system dysfunction, allowing for personalized care plans that actually address the real root cause rather than just managing the signs and symptoms with medications or endless therapies. Now, the INSiGHT scans are so powerful as they aim to look deeper at the root cause of what the body is doing and why. And as you know, it can be so important to look deeper, especially when other avenues haven't given the full answer. So click the link in our bio to learn more about the INSiGHT scans and how we would love to help.